Nurse!
Yes, ma'am, how may I help you?
My chest really
Your chest. Would you like some water? So I'm here looking at your chart, Mrs. Washington, and it tells me that you have fourth degree heart blockage.
I'm out. My name is Lee, and in this video, we're going to be talking about a third degree heart block. There is no such thing as a fourth.
Hey, Mrs. Washington, I have a few questions here for you. Is it possible that you could be pregnant?
Yeah.
Miss Washington, how old are you, may I ask?
70.
You're 70?
Yes.
Timeout. Patients with a third degree heart block, which is also known as a complete heart block, can experience symptoms like fainting, dizziness, shortness of breath, and even in severe cases, cardiac arrest.
You know the knee injury that you have can cause a fourth degree heart blockage.
I never know.
Wait a minute now. Time out. A knee injury is not likely the cause of a third degree heart block, but here are a few things that might. Third degree can be caused by electrolytes imbalances, simple things as medications and calcium channel blockers, or even cardiac surgery. Trauma can also be caused by just the heart muscles being weak or damaged.
Sorry to tell you this, but we're gonna have to amputate your leg to solve this issue.
What, lady? What? Nurse? What?
Wait. You're just gonna wait for the doctor to confirm this, so give me a minute.
I'm out.
So no legs needs to be amputated today with a third degree heart block. What you do need is a cath lab and possibly surgery. So if you're experiencing chest pain, maybe difficulty breathing, it's important that you get yourself evaluated.
Now, we've talked about the presentation, causes, and treatments of third degree, but let's talk about what it will look like on an EKG. One of the main things you would see with a third degree heart block is your P waves marching on and doing their own thing. Now, they are definitely synchronized properly, always coming back on the same time. So you would see them just hit whenever they hit. Sometimes they're before the QRS, after the QRS, or even inside the QRS. You also see some weird T waves when the P is also merged with the T. In this case, one other iconic thing to look for is knowing that the ventricles are completely on their own, which in most cases would make them wide. Keep in mind it's a complete heart block, so the atrium is sending signal. It's just not reaching the ventricles to tell them to contract on a certain pace. So now the ventricles are doing so on their own. Knowing that small detail will help you when you're faced to determine whether it's a third degree or a second degree type 2, or maybe even a type 1. So here we have a second degree type 2. Can also look similar to a third degree, but here's one key thing to remember. In a third degree, that complete blockage, it never goes through. But in a second degree type 2, it sometimes does go through. And it is indeed the atrium that tells the ventricles to fire. Therefore, every QRS will normally have their P wave next to them. So despite all the chaotic that you see in the rhythm, look for the QRS, and if there's always a P for every QRS, then chances are it's just a second degree type 2 and not a third. Now let's recap, starting with presentation. Patients with a complete heart block would normally have chest pain, dizziness, shortness of breath, in some cases fainting, and if severe, they'll go into cardiac arrest. Now causes. Well, we're looking at damaged heart muscle tissue caused by multiple heart attack or previous heart attacks, electrolytes imbalances, cardiac surgeries, even medications, calcium channel blockers, and the digoxin being one of the infamous for that, and beta blockers as well. For treatments, this patient will definitely need a cath lab and possibly surgery. But out there as a paramedic in the pre-hospital settings, just go ahead and follow your state protocols. Make sure this patient get oxygen if they are hypoxic. Attach your 12 lead to confirm your rhythm. Get some access, monitor their vitals. Prepare for rapid transport. You don't want to wait around on scene on this one. And it's possible that you have to pace. Whatever medication is needed to also speed up their heart within your protocols, go ahead and do so. And that concludes this video on third degree heart block. My name is Leaton Mitchell. Thank you again for watching, and hopefully this was educational in some way, shape, or form. Have a good day.